I'm Betty Ann Hedges. I'm the Executive Director of Humanist Canada. Before we begin, I wanted to give you a few little highlights of what's coming up in our programming schedule. On March 10th, Dr. Speed, the University of Ottawa, will be with us in discussion with our own Daniel Dacum. Dr. Speed will be speaking about the false claims that many have around the health benefits of being a religious person. On March 19th at 7 p.m., our platform we're going to share our platform with the BC Humanist Association and the Centre for Inquiry Canada, and we're going to talk about the cost of religion in Canada. Few shocking stats there, and it should really be some good dialogue. On March 28th, we welcome Dr. Rita Deverell. She's a Governor Award winner, the founder of Vision TV. And many of us in Humanist Canada are writers, podcasters, performers, as Jared is, and we often struggle to speak to diverse audiences and to find that respectful tone that opens minds and enables good dialogue. And Dr. Deverell, that will be her topic. So she's a Canadian treasure. So please join us for that. A reminder, we are recording. If you do not wish to be in the recording, please turn off your camera. So on behalf of Humanist Canada, I'd like to welcome you to our presentation today, an update on HIV. It's gone off my radar, so I'm really looking forward to today's conversation with Alison. So much is still going on with this disease, and we thought time for a revisit. Please remember that all of our programming is made available due to the generous support of our members. Thank you. And I want to introduce you now to one of our Humanity Program members, Humanist Canada officiant and all-round fun guy, Jared Clegg, who is our host today.
And this should I wait for the orchestra to kick in, or hello everyone, thank you, and welcome to this wonderful discussion about HIV. And today, my name is Jared Clegg. I'm an actor, performer, wedding officiant, Humanist Canada podcast editor, possibly host sometimes, all of that around. And it's really excited to have today Alison Symington, wonderful person with a lot of information, talking about a very complex issue. I will be your host today and also facilitator of any questions that you may have. If anything comes up during the discussion, if you want to, you can pop it into the chat box, and I'll address it when we can. And we'll be going through her presentation, and then we'll have a bit of a Q&A at the end. So don't be afraid to have any questions or suggestions. Now, without further ado, let me introduce Alison Symington, a legally educated human rights researcher, advocate, project manager, all those things, plus senior policy analyst at the HIV Justice Network, a wonderful non-for-profit organization. But we should also make aware that she is not a doctor nor epidemiologist, and also probably nobody else here. So, but it doesn't mean we don't have a lot of knowledge and advocacy for what we're talking about. So without further ado, I'll turn it over to Alison.
Thank you so much, Jared, and you as well, Betty Ann. It's a pleasure to spend my Sunday afternoon with you. As Betty Ann mentioned, I was speaking with her a while ago and used an example from some HIV work, and she said, "Wow, we haven't talked about that in a while. What's going on in that world?" So we thought this would be a good opportunity just to update you a little bit on what's happened in the world of HIV since it's kind of fallen out of the focus of the news. And there's so much that can be learnt from HIV activism and the work that's been done around HIV to help us figure out how to deal with, other public health emergencies and epidemics. So I think it's a valuable thing to look at. So what I've done in the spirit of that update is I have about 10 or 15 minutes of slides, which are just kind of an overview of what's happened in terms of HIV, and then we can open it up to some questions. So I will start by sharing my screen. All right, perfect.
Good.
All right, so as I said, what I want to do today is just kind of look at 40 years of HIV, what's happened, HIV is the virus that, if left untreated, can develop AIDS. We used to always say HIV/AIDS, but they are two distinct things. So I will be referring to HIV. I've put a few questions here that I thought were things that people might be interested in discussing, but I really leave it open to all of you in what direction you would like to take the conversation in. And as mentioned, but just to clarify, I am not a doctor. I cannot answer your treatment questions, but I'm very happy to talk about human rights and social justice and the HIV movement. So a little bit of background, because I want us to have some foundation to talk from. So about HIV transmission. HIV is a virus. Infection occurs when enough of that virus enters someone else's bloodstream to initiate a new infection. And there's only 5 bodily fluids that can contain enough HIV to initiate a new infection. So those are listed there: blood, semen, rectal fluid, vaginal fluid, and breast milk. Note, you cannot get HIV from being spit on. There's no HIV in urine. It's important, I think, for people to know the facts about transmission in order not to be, unnecessarily concerned. So primarily, infection happens through sex without condoms or other protection, through sharing needles, whether that be to inject drugs or tattoos or hormones, whatever. And HIV can also be transmitted from a mother to an infant or to a fetus during pregnancy, labor and delivery, or breastfeeding. So some important terminology to know is viral load. So what viral load refers to is the amount of HIV that's in someone's blood. So if you are a person living with HIV, your doctor will measure or order blood tests to measure your viral load every few months. That's how they know if the treatment is working. And it's measured as copies per milliliter in the blood. So the whole point of HIV treatment is to lower the amount of HIV in your blood, lower the viral load. And viral load can actually, with successful treatment, be lowered to a point where it's undetectable. Meaning if you were to go and have an HIV test, it wouldn't show up on the test. You still have reservoirs of HIV in your body, and if you stopped your treatment, it could start replicating and reproducing again. But if your treatment is successful, it gets to that undetectable level. Now, this is amazing, because if the HIV is undetectable in your body, then it's no longer attacking your immune system or impacting in a negative way on your health. So with proper treatment and care, people living with HIV today can live long and healthy lives and avoid passing HIV on to other people. U equals U is a slogan you now hear a lot in the HIV sector. It means undetectable equals untransmissible. So what this means is that if the viral load is at that undetectable level, not only is it not negatively impacting your own immune system, you can't pass it on to someone else. So you could have unprotected sex with someone living with HIV who has an undetectable viral load, and you would not be at risk of developing an HIV infection. So this is huge news for people living with HIV and for people in general who, it's just a huge medical discovery and really, really exciting. And remember, it's only been 40 years since HIV has been around. So U equals U is pretty good news. So just some statistics on the situation in Canada. These are the estimates from 2020. So that's the most recent year that there's national data available. So 62,790 people were estimated to be living with HIV in Canada in 2020. 6,590 people are estimated to be living with HIV but unaware of it. So take note, that's 10% of the people living with HIV don't actually know they're living with HIV, which is very important in terms of new infections. And in terms of new infections, 1,520 is the estimate of the number of people who became newly infected with HIV in Canada that year. Now, of course, this isn't just a Canadian disease, it's a global disease. So these are the global statistics from the World Health Organization, and these estimates are from 2022. They publish more recent information. So 2022, there was an estimated 39 million people globally living with HIV. 1.3 million became newly infected in 2022. 630,000 people died from AIDS-related illnesses in 2022, and 29.8 million people were accessing HIV treatment. So note that means there's 10 million people in the world with HIV who don't have access to treatment, which is a big issue. Now, the key populations, these are the people who are most directly impacted by HIV and also who are critical to ending the HIV epidemic. That's people living with HIV, sex workers, gay men and other men who have sex with men, people who use drugs, transgender people, and people in prisons. So the other thing I thought we'd do is just go through a little bit of a timeline. Now, 40 years, all kinds of things have happened, but I've picked out some things that I think really show important elements of not just the epidemic, but the response to the epidemic globally. So let me grab a drink of water here. And we can cast our minds back to 1981. That's when there were the first reports of this mysterious illness in the United States, affecting primarily gay men around San Francisco. This was the illness that would later be identified as AIDS. Now, by 1982, so within a year, the gay men's health crisis had been established. And I mention this because it was the first community-based AIDS service provider in the world. And community-based organizations have really been the leadership in terms of the HIV response. So very, very early on, the community started stepping up, taking care of each other, advocating for what they needed. 1982 realized that this was a sexually transmitted infection. And by 1983, what had started out as this illness we were hearing about from around San Francisco, there were cases around the world. So in 1983, there were AIDS cases in Canada, in 15 different European countries, in Haiti, Zaire, 7 Latin American countries, and Australia. So it's spreading. Now, by 1983, scientists identified the retrovirus that actually causes AIDS. So that, of course, was a very big and important discovery. 1985, actor Rock Hudson dies of AIDS. Now, I mention this because this was the first public figure who really came forward and let people know that he was living with HIV right at the end of his life, and that we knew had died of AIDS. So we see here a shift in the public conversation and the visibility of HIV and AIDS. Excuse me. By 1986, we discovered that HIV can pass from a mother to a child through breastfeeding. Originally, this had been very much seen as a gay men's disease, and much of the research and advocacy was focused on men. So we're starting to see a shift now to the recognition that heterosexual sexual transmission and so-called vertical transmission from a mother to a child are big parts of the epidemic as well. Now, in 1987, the FDA approved the first medication for AIDS. This was AZT, very, very harsh medication, but the first medication that's available as a treatment. So up until this point, a diagnosis with HIV was necessarily a fatal diagnosis. Within a few years, most people would be progressing towards AIDS-related illnesses. Now, you may remember the very famous footage of Princess Diana shaking hands with HIV patients at a London hospital. That was in 1987. If you have seen that footage or you've heard about it, you will know that many people were very shocked that she would touch someone living with HIV. So, that's where we were at in 1987. So moving along, in 1987 is when the first needle exchange program was established in Toronto to protect people using drugs from HIV and other bloodborne infections. Note, this was also established by the community. It was an unsanctioned center. Again, the community pushing forward with the evidence-based interventions long before the government was. Now, 1990 was kind of a big year in Canada. The Canadian Association for HIV Research was founded that year, as well as several other large HIV organizations. So by this time in Canada, we see the government starting to get really involved, the health community getting really involved, and the response growing. 1993, I note here that that was the year the film Philadelphia was released, starring Tom Hanks. At this point, might not seem like a big deal, but that was the first time HIV had been addressed in a major motion picture, and really opened up the visibility of the illness and the kind of public discussion about HIV. So just over 10 years after the illness began. So by 1994, AIDS becomes the leading cause of death for Americans aged 25 to 44. So that's in the US. Leading cause of death is a lot of deaths. So 1994, this was pretty major in the medical field. 1995, the WHO estimates that approximately 18 million adults and 1.5 million children have been infected with HIV. So again, just over 10 years, this has spread around the world, and people are dying in very large numbers. Now, 1996 is a very exciting year for HIV because that's when we discovered what's called HAART, highly active antiretroviral therapy. So basically, what doctors discovered is if they took several HIV medications and put them together, people refer to it as the cocktail, you put them together, you attack the HIV virus at different stages, and it had amazing impacts for people living with HIV. And this is when we start to see the ability to lower the virus, and HIV is no longer the fatal diagnosis that it used to be. So in 1996 is when UNAIDS, the United Nations body focused on HIV, was established. And here we start seeing a more organized international response to what's happening with HIV. Now, in 1998, that was the year that there was an explosive outbreak of HIV amongst people who use drugs in Vancouver. So you may recall that the downtown east side in Vancouver was the area in the whole world, the highest concentration of HIV infections in a developed country were in the downtown east side in Vancouver. So Vancouver was very much a center of the epidemic in Canada, and also central to a lot of the research and activism around HIV in Canada. So final slide in my timeline, we're up to 2001 now. So by 2001, we've got 40 million people living with HIV and AIDS in the world, and 24.8 million people have died of this illness in this relatively short period of time in the life of the virus. Important to note that 50% of those people are women. Now, you will recall that I pointed out in terms of the numbers that a large number of people living with HIV still don't have access to treatment. The situation is better now than it was. So in 2003, the World Trade Organization recognized that developing countries had the right to develop their own generic medications or to buy generic medications for epidemics such as HIV, because up until that point, pharmaceutical companies held the copyrights on these medications, and people were dying because the countries couldn't afford to buy them. So while there's still a huge number of people who don't have access to treatments, 2003 was a big year in international trade law because the World Trade Organization recognized that profit and copyright wasn't the only consideration, and that countries should be able to develop their own generics or buy generics. So 2011 is the next year that there was a really major piece of news in the HIV community, and I've already referred to this a little bit. So this was the year that the big study came out that showed without any doubt that the treatment used to treat HIV also prevented the onward infection in heterosexual relationships. So really a big game changer in terms of HIV. 2014, it was confirmed that that also applied to gay men. Not surprisingly, transmission happens through fluids. Of course, it's going to be the same, but had to be proven in the research. So again, huge game changer from like the original discovery of treatment to this understanding of treatment as prevention, or U equals U, as the community called it. Completely transformed what it means to live with HIV. So in 2014, the governments of the world set goals, targets, and those targets are called 90-90-90. And what the goals were that 90% of the people in the world who were living with HIV would be diagnosed. So 90% of people living with HIV would know they were living with HIV. And then of that group of people, 90% of those people would have access to treatment. And then of that group of people, 90% would achieve and maintain an undetectable viral load. So, each of those levels, there's a bit of fall off. But the mathematical models showed that if we could reach those levels, we could basically end the epidemic in the world. So those were the goals. We were all going to work together globally to achieve those by 2020. 2017 is when the U equals U international campaign began, and that really became the rallying cry of people living with HIV the world over. One, we need access to treatment. Two, let's end the stigma and the human rights violations against us. Let's understand that U equals U, and our goal is to get people to an undetectable viral load. I'll end with 2020. Not surprisingly, we did not reach those targets, and we still continue to work towards them, and there's many, many reasons we didn't reach them. But in 40 short years, really, we went from an unidentified virus to massive illness the world over to these quite amazing treatments and the U equals U campaign. So a lot happened, and much of it was driven by community members. You might have heard of ACT UP, an organization that did protests in the streets. There were Canadian activists disrupting conferences and confronting government officials in order to gain access to pharmaceuticals that were too expensive for them to afford, but that they needed in order to stay alive. All of the issues around providing for orphans in Africa, has been a huge fundraising and advocacy area, because so many parents were dying and their children were being left without the basics that they needed. So all over the world, the community of people living with HIV and human rights defenders have really led the activism that led to these changes, and worked very, very closely with scientists and doctors who were working on the treatments and prevention. So, in a very short time, a lot changed in the way that global health issues are handled in the world. And, some of those lessons were applied when COVID struck. Some seem to have been very much forgotten. And some of the errors that we saw with our response to COVID. But that's the 40 years in a nutshell of HIV. And there's some data sources if anyone is interested in following up on any of that.
Well, first off, thank you very much. That was actually a lot. A lot of important information, especially that timeline. Like, really helps put it in in awareness and everything. So do we know now what is the current state of HIV in the world today? How's America and Canada doing? How's the rest of the world doing? What has worked? What hasn't worked? All pretty much every single thing you can say. You can speak about AIDS. Go ahead, Allison.
I'll just give it all to you.
Yeah.
Well, I think the big things are around the numbers. The most recent numbers that I shared from Canada. You still see a big gap between the number of people living with HIV and the number of people who are actually diagnosed and accessing treatment. And in order to end the spread of HIV, we need to get treatment and diagnosis to those people who don't have access to that. And, as with most things, we do the easy stuff first. And then you get to the harder stuff. You get to people who, have faced discrimination and stigma and therefore don't trust healthcare facilities and don't want to come forward. You get people who live in remote areas and don't have access to healthcare and don't have access to medication. So we're now at a point in Canada's response of trying to get the trickier and very complex kinds of pieces. And it's really at this point not so much about the medicine. It'd be great to have a cure. Like, of course, it would be great to have a cure. It would be great to have a vaccine. But without having those things, we still can pretty much eliminate HIV. I think one of the key things to recognize is it comes down to some of the more socially controversial policies. So, in my neighborhood, there's a big debate about the supervised consumption site and the harm reduction facilities locally. And, there is evidence from countries around the world showing how essential those services are to ending the spread of HIV and hepatitis. So it's a lot of issues that are now we really need to look at the science and look at what we know and what we've learned and make the really difficult decisions to get, that last bit of the response. And, the other piece that really became clear to me during COVID is some of those lessons we've learned in the HIV response were completely forgotten when we faced a new emergency. And one of those things is it's been shown over and over and over again that you need to recognize people's rights and empower them. And punishing people and criminalizing people doesn't help. It really, exacerbates the problem. So, when in the early days of COVID, the city of Toronto starts shutting the parks and people start yelling, well, we need to ticket people. We need to, criminalize the people who aren't following the prevention. And, sure, that's an easy response. But I think if we looked at what we know from HIV, we would know that that was not going to help the situation at all. And in fact, when they started tracing who was actually getting tickets and being charged, it was overwhelmingly poor people of color. And, rich white people were still having parties, but they weren't getting ticketed. So if you look at, the whole social construct of how we respond, empowering those who are most vulnerable and most at risk of the illnesses is really essential to actually ending them. And I think we've seen that through HIV, we've seen it through hepatitis, we saw it through COVID. And, as we continue to deal with epidemics in the world, those lessons and that community leadership, the people who say, look, this is what's happening in my community. Here's how we can handle it at the level of my community in terms of our needs and the way we're living and the stigma we're facing. We need to listen to those people and, fund those programs, even if they're not the most popular or the easiest ones. That's what's going to make the difference.
I was really, I marked where you had on the timeline the two big, the media events, right? And I think that's so interesting always in society, that power of Hollywood. And I've said a few times, if the Canadian Indigenous issue had the same exposure that the American Black issue had, we'd have a better understanding here of that. And that's just a side example, because I remember when AIDS first came into the watching, Tom Hanks and hearing about Rock Hudson. That was probably my first understanding of what that was. And I tell you, it was probably my first understanding of what this word gay meant too. And that's interesting to see how that just kind of lifts it into the modern, our conversation. And that good. And I clearly remember we had the play last year here in Stratford, that at the hospice in Toronto, and the play's now in Toronto. It was first shown here in Stratford. You can now see it in Toronto, but the name's gone out of my head. But it was the day that Princess Diana visited the hospice in Toronto and all around that. And really an interesting look at that time in history, what she brought, just somebody, just this figure floating out there in our imagination. But when those two come together, that greater understanding of an issue is so powerful. And I just keep saying, I hope that Taylor Swift phenomenon helped with this election, because, if she can draw a highlight to the impact that Trump could have, I think that could move things forward. And I find that so crazy that we need to think that way. But, in all of these cases, whatever it takes.
Yeah, and until it's in the public discussion, like it's quite amazing to think of the thousands of people who were living with HIV and dying of HIV, and no one was talking about it. Like it's until it gets into that public discussion, and in a way that isn't just stigmatizing and jokes and that kind of thing, but a real, Tom Hanks' performance, I think, changed a lot of minds and educated a lot of people. And the same with Princess Diana and many other things. It's that role that pop culture in that way can play is very important.
And that's still the days where, hard to imagine for some of the younger faces here, but the days where we'd all say, but I don't know any gay people. Do we have gay people in Canada? Like, it was just so it's a really, and not much time has gone by since that, really. Yeah.
Yeah.
Huh.
Well, I mean, you can also look at the timeline of, as I was watching, of 1981, when it was first started becoming aware, and then they've now gone to the press conferences of the Reagan administration, and I think it was 1982, and it was I'm trying to remember the exact guy. I think it was Lester Kinsolving. Anyway, he actually, like, they have recordings of saying he actually brought this up before the Reagan administration in 1982. Hey, we have this disease that's happening. It's happening in the gay community. Everyone cracked jokes and then moved on to the next thing. 1983, he brought it up. 1984, he brought it up. And it wasn't until Rock Hudson, who everybody knew was Reagan's buddy, announced that he was dying of AIDS and then died shortly after, did Ronald Reagan finally actually acknowledge and say the word AIDS. It wasn't until, it was like we were saying, 4 years of it being brought up for him to finally actually acknowledge that it existed. And by then, thousands of people had died. It had, mass spreading. It was ignorance. It was pretending it didn't exist because gay people didn't exist. And that is what led to the proliferation of this disease. Like, we could have done a lot to nip it in the bud then if awareness had been brought out, but because of that,
and I think today we see the same around drug users and sex workers, and we don't want to talk about them. Politicians don't want to talk about them. But if we did, and we took their rights seriously, as we now, for the most part, recognize the LGBT community and, recognize rights and condemn discrimination, it's it's tough sometimes, but until we do that, it became the leading cause of death in the US, and Reagan wouldn't even say the word.
Which I would
That's
like to say
striking.
for the record, right now the leading cause of deaths for people between 25 and 44, which is, let's be honest, our prime of living, is heart disease right now. So for the fact that AIDS was the number one killer is beating heart disease in the 90s, it really tells you how much of a pandemic it
Yeah.
was. But it was also, it's like, oh, well, we don't talk about that until, a politician's son gets it. And then suddenly it becomes an issue that they need to address.
Yeah. Yeah.
Um,
All of those obituaries that had, the cause of death was whatever. We're not going to tell people that our son was gay or that our son died of AIDS.
Exactly. And also it was still the painting of it being the gay disease, which it wasn't, but it proliferated in a community and then is stigmatized and then it never went beyond that. And so, I'm sorry, Jill, you have your hand up virtually.
Yes. So yes, to get back to Jared's comment, I was actually in Jack Layton's ward as a student at Ryerson, and he was the only one talking about this disease that was hitting the gay community, and nobody was listening. So that, but he was making that very, very clear. So actually, I became quite aware of it due to him being so active about it in the ward, and I happened to be in it. So that was interesting. But getting back to comment you made earlier, Jackie, on that timeline about the remote access to medical care. Like, I'm in the Ottawa Valley, and you would not believe how many people do not have access to a doctor here, right?
Mhm.
So I guess in terms of the social aspect, with the sex workers or women who are marginalized in these remote communities, how many of them are getting infected and how many of them cannot get treatment and are passing it on to their unborn children? I'm just kind of curious if there's any statistics about that.
Yeah, I don't have the numbers in front of me right now, but what we call vertical transmission, but it's usually mother to child transmission, is actually very, very rare in Canada now.
Okay.
Most women are offered an HIV test during pregnancy, and treatment's initiated. And if a woman's on treatment, the chances of passing it on to a child are practically nil. When and I haven't looked at the numbers in a few years, but when I last looked at them, there'd been one case in BC, and it was an Indigenous woman from the north who hadn't had any medical care during her pregnancy. Like, they happen very, very seldom now, but when they do, it's often someone who doesn't have any access to testing or care. The other piece that's critical is with HIV treatment, you have to take it consistently. And you have to take that treatment every day as prescribed. And if you don't, your viral load can rebound, and you can also become that those medications won't work for you anymore. So for people who are homeless, even if they can get a prescription, do they have a place to store it? Can they take it consistently every day? And that's what's required to keep someone's viral load at that undetectable level. So when people are actually have a detectable viral load, are ill themselves, or can pass it on to other people, it's often because they don't have access to testing, treatment, homes, those kinds of things. So
you're saying the AIDS pandemic is also a human rights epidemic as well.
Yeah.
It
absolutely
comes down to the haves and have-nots.
Absolutely. And that's, why I've worked in HIV for the last 20 years and I am not a doctor. It's because it is a human rights issue, a huge human rights issue. And the rights of people living with HIV and other key populations impacted by HIV are violated daily around the world. And if we end a lot of those human rights violations, we would be able to get these illnesses under control.
Alan, you have your hand raised, and then I'll go to the chat.
Yeah, can you hear me okay?
Yes.
Oh, great, Alan.
Oh, great. Okay. Yeah, great to be here. Thanks, Alison, for the presentation. It brought me back to the 1980s when I was working in the hospital here in Sarnia. I was the manager of the microbiology lab, and I was on the infection control committee. And I can remember the fear among the healthcare workers about transmission of HIV. And, we did a lot of education with the staff around transmission and how they can protect themselves and what they should not be afraid of doing. Um, but it was quite a difficult task. And we decided to bring in a doctor from Toronto who was a member of the Toronto AIDS Committee, who also had HIV himself. He agreed to come to Sarnia and speak at a seminar that we put on for the staff. At the last minute, he was unable to attend because his illness was declining, his health was declining. But he did send another HIV positive person to speak to us. And I remember how powerful that was to welcome this man into the seminar, to have him sit at the table with us, to have lunch, to shake his hand, and just treat him like a normal human being, which he was. And that was just such a powerful lesson for the rest of the staff to see that and put their minds at ease that this was not a virus that was easily transmitted. And if I could just share one other quick story. One of our doctors volunteered in Haiti, and he was in a hospital, and he told me that one of the patients had AIDS and had a lot of lesions or skin ulcers, and he decided he would wash the man's legs that needed to be taken care of because of these ulcers on his legs. And he began gently washing the man's leg, and the man started to cry. And the doctor asked him, am I hurting you? And he said, no, I'm crying tears of appreciation because you're the first person who has touched me in a long, long time.
Yeah.
And I just thought that was a very powerful story.
Yeah, and the stigma and the misinformation and the fear that generates, I think, is one of the lessons we really should take forward from what's happened with HIV is, we need to inform ourselves with the facts and not fear the unknown, not fear people who are different than us. And it's horrible to think of what people went through in those early years when, their families rejected them, no one would touch them, healthcare workers were afraid to treat them. It's
Still
it's very
ongoing.
sad.
Jackie Cooper, who I'm a big fan of her husband, has asked a very good question: is how is Canada doing in comparison to the U.S. in terms of HIV efforts? The awareness, the prevention. What are we doing right? What are we not? What are we doing wrong? If we have that much time. So how can we speak to that, Alison?
Well, I don't know. It's hard to say in that, the population is so much bigger in the US and HIV outbreaks tend to be concentrated. So, around DC, amongst Black people in DC, the rates were super, super high. And I don't think we have a city in Canada that would be comparable. Um, I think we were doing quite well for a number of years in terms of access to treatment, and there were lots of programs to get different types of testing available in different settings to try and get people who, didn't go to their family doctor, they could go to the hassle-free clinic or, all kinds of different options. But, a lot of provinces now have provincial governments that are very conservative. And I think we're seeing all around us a rise of hate and misinformation and false news, which I think is, we're not doing so well anymore as we're cutting funding to essential services, as people don't have access to doctors. I think we're starting to fall behind where we had been doing quite well. Some of the leading activists, HIV and human rights activists in the world, are based in Canada, as well as some of the leading researchers are based in Canada. So Canada has always been seen as somewhat of a leader in the response. But Canada continues to criminalize people for not disclosing their HIV status to sexual partners, even in circumstances where it would be impossible to transmit the virus. And, we've been trying to get that law changed for close to 20 years now and still hasn't happened. So, there are some very obvious things that could be done to reduce stigma, and reducing stigma and protecting people's rights is, one of the best ways to get people to treatment and testing. So yeah, I think it's hard to compare the US to Canada, but I think Canada is making some of the mistakes now that we weren't previously, in a more US kind of political popularity policy making as opposed to evidence-based policy making.
And as Jackie just asked, mostly because her microphone's not working, does defunding typically follow suit with uptick in cases?
I don't have that data. Yeah, I don't have that data.
Okay, you can make it up. Go ahead.
My guess would be yes, but it's a guess.
Yeah, cancer, everything else, they've been able to track that.
I mean, with the defunding of any programs, you typically get the uptick in the things that programs were helping prevent. So yeah.
Yeah, I know around hepatitis C, when needle exchange programs are defunded, the rates definitely go up. But I can't say in terms of all of the other things.
Alison, I was going to say, like, just to expand that thinking, what about Africa and places where we knew numbers were very high, and you look at that 30 million people with getting treatment now, you could assume there isn't consistent access to the pharmaceuticals in some of these countries. Is that what is continuing to incubate the disease and these
It's definitely one of the things. In different parts of the world, we've had very different types of epidemics. So in Canada and the US, the epidemic was very much amongst gay men and people who use drugs. Whereas in Africa, a lot of African countries, the epidemic was mostly amongst heterosexual couples. So the interventions and the responses and the impacts are very different depending on what type of epidemic there is. And there's all kinds of epidemiology that traces, how things are transmitted. But the lack of access to treatment means that the virus is continuing to be passed on, where if people had access to treatment, they wouldn't have that. So there's about 10 million people in the world who are diagnosed with HIV who don't have access to treatment, which means those people could be passing the virus on, as well as their own health is being attacked by the virus. So there were a lot more transmissions from mother to child in Africa, again, because of the type of epidemic that they had there. So I think in those targets, the 90, 90, 90, the mathematical model shows that, you need the treatment to be accessible and successful. And to be successful, people have to have access to a doctor who can adjust the medications if they're not working right, who can, test their viral load and make sure it's staying at that low point. So, it's the three pieces together that they calculated could end the epidemic. So if people have access to testing, but then don't have access to the treatment, there's, all of those pieces. And there were a lot of issues with what they call stockouts in Southern Africa, when a medication would just become unavailable for a few months, So people who were on that medication, their viral load would then rebound, and that medication might not work for them anymore. So all of that lack of access to healthcare has allowed the pandemic to keep going.
I remember seeing I think it was a documentary, something from the Stephen Lewis Foundation, that an entire population, an entire geography or demographic, if that's the word I want, an entire demographic of a generation had disappeared. So grandmothers were stepping into this role of parenting their grandchildren because the parents had had been impacted by this, and it changed families and millions of people.
Yeah, absolutely.
Yeah,
absolutely. The impact in Africa is quite different than what the impact has been here, but quite horrifying if you think of like all of the teachers and all of the parents and kind of this whole generation that was decimated.
Clearly, we just botched the goal of 90-90-90 by 2020. What's a new goal? What's a new thing that we can shoot for, other than obviously, because you have the problems of one, awareness, one, consistency, and then people voting out of fear rather than actual intelligence. What else can we do? What's a more achievable goal, or are we looking at a rise and the potential of more if we don't start doing this? Because as we're aware, unhoused and homelessness is increasing. Prison populations, which are unfortunately, two large areas where HIV does tend to spread because of just the way the situation is. What's happening now? What can we do?
Well, at the global level, when we missed the 90-90-90 targets, they developed new targets, of course, because that's what you do at an international level. So now the targets are 95-95-95. So it's kind of, we took too long to get there, so we have to make the target higher. So now it's 95-95-95 by 2030. But they've added 3 new targets, which are completely impossible to reach, but I think show a much better analysis of the situation. So one of the targets is about lowering rates of sexual violence and kind of recognizing that violence against women, intimate partner violence, rape, sexual assault is a huge issue with respect to HIV. So they've added a target around lowering sexual violence. They've added a target around stigma and discrimination and I believe it's that only 10% of people living with HIV would experience any stigma or discrimination because of their HIV. Totally impossible to measure, let alone meet that target. But it does recognize that it's not just about handing out medication. We have to actually make people comfortable to come forward for services and end that discrimination. So there's a whole, area of focus now around human rights and discrimination. And then the third thing is around punitive laws. So we have to end the punitive laws. So in many countries, you can, go to prison for having sex if you live with HIV because you could potentially pass it on, all of those kinds of people losing their jobs because they have HIV, any kind of punitive punishing people for the illness is the third goal. So that's what they've done at the international level. I think what we can do personally in our own lives and in Canada is to recognize diversity and protect the most marginalized. When we're making public health policy, we have to look at those who are the furthest away from being able to protect their own rights, the people who have the least access to treatment, people who have the least access to shelter. If we prioritize those who are most marginalized, we'll have the best results overall. And we base our policies on evidence, not on what we think might be the most politically popular decision or based on our own limited experience, what makes sense to us, but actually look at the evidence, talk to the people who are living in that situation. They're the experts in their own lives, and find out what would actually work. I think those are the things that we ourselves can prioritize in terms of HIV, but really broadly any public health issue, because the one thing we learned from HIV and the HIV movement really transformed the way global public health issues are dealt with. And that was because people living with HIV took the leadership and were loud and were pushy and really put, the trajectory of the disease would be completely different without that community leadership. So I think we can apply that lesson now to any number of public health crises by saying we need to listen to the communities who are impacted and the evidence about what interventions work for them. So I think that's what we can do.
So Bill Gates has malaria championing the destruction of it. Was Michael Johnson? Was he the one who was that we could use as the poster boy of what Magic Johnson was able to do is raise awareness and put that out there and said, hi, I'm a straight person who acquired HIV, and through whatever miraculous way he was able to do it, he was able to overcome that. But he still had, what champion do we need for that? Can we, what other rich guy can we say to come around and say, I'm going to tackle the, destruction of this disease?
Well, Gates throws a lot of money at HIV. He certainly does. So he's one of them. But I think in terms of, celebrities and public figures, there are people living with HIV in every field. If we went to look, we could find doctors, we could find singers, we could find TV stars. So, I think part of it is about people being willing to tell their stories and to share that information, and people being willing to listen. If you've already decided that all gay people are evil, or all people who use drugs are immoral, or whatever it is, it doesn't matter what they say. It's not going to change your mind. So, but yeah, there are some pretty good spokespeople out there, and people living with HIV telling their stories is always very powerful.
Alan, real quick, as we're closing up for the webinar.
Okay, yeah, very interesting what you say, how different things are in Africa. I'm just wondering, do you have any insight into what's happening in Russia, where they discriminate against gay people? I mean, is HIV still a real problem there?
HIV is a huge problem in Russia, and in addition to discriminating against LGBTQI plus communities, they also have a very punitive approach with respect to drug use and sex work. And so very, very high HIV numbers, as well as huge arrests, massive prison populations living with HIV, because of course they don't have any needle and syringe programs or any prevention. So yes, it's one of the areas in the world with the biggest mess in terms of HIV.
And so I guess we can say it always comes down to the community, because I'm aware that in the LGBTQ plus community that the use of PrEP is actually very normalized and very advocated for in the green. I know I realized this was in 2017, and even today, I guess I would say in Canada at least, or it depends on where you live. But if you're able to take PrEP regularly, that has been promoted, and I think has been making huge gains in the community. But you never see posters for that. You never see, anybody coming out saying this, but it's just been word of mouth of like, hey, this is what we can do if you're going to be sexually active in this community, is take your preventions. But again, we need more advocacy for that, more awareness of that.
Yep, and more education, more organizations that are handing out that information, more family doctors who are open to talk about it with people. For those who don't know, PrEP is a medication you can take that prevents you from establishing an HIV infection, so you take it before you think you might be exposed, and PEP is something you take after an exposure. And they're all based on HIV medications, but can stop that virus from establishing an infection. But yeah, it's the community. People take care of each other and spread the information around.
Well, that's wonderful. And also being clarified that there was actually a poster at the church subway station in Toronto. They did have a PrEP ad. See, we're doing this in real time.
Thanks, Jackie.
Well, Betty Ann, do we have more time, or should we start winding it down?
Yeah, if there's more questions other than that, we can wind it down, let people get on to their Sunday dinner.
Sure. Then I think a good note we can end on is awareness, acceptance, tolerance, all those easy achievable goals helps everybody.
Right. Yeah, very good. Yes, thank you, Jared. And thank you, Alison. This was very informative, a bit alarming. I think we need to be alarmed every once in a while, and nothing does that better than stats. So thank you for that research and, enlivening those numbers. And thank you to all of you who attended, both now and in person, and those who will be watching the recording. It will be on our Humanist Canada website, www.humanistcanada.ca, and on our YouTube channel. If you are not currently a member, and this is the type of programming you support, have an echo, then please become a member. Any questions, please reach out to me via the website. And thank you very much, everyone.